If I'm noticing that I'm getting a little tightness or uncomfortability when I'm picking up my toes, one of the first places I'm going to look is tibialis anterior, extensor digitorum longus, and extensor hallucis longus. So let's go check them out. First, find your shin bone, the bone in the front of the leg, then go just lateral of that, and that's your tibialis anterior muscle. Continue moving to the outside, and you'll get to the extensor digitorum longus. Then halfway down your leg and deep to those two muscles, you'll find your extensor hallucis longus. Now that we know where the muscles are that we're looking to work, we want to press our thumbs into the tissue. We're going to start up at the knee and push down towards our ankle. Start just lateral at the shin bone, and once you finish each line, just move a little bit more towards the outside until you get all the way to the side of your lower leg. Next, we're going to stay in the same areas, follow the same pattern, but we're going to move the tissue side to side, doing a little cross friction. Now that the tissue is a little more warmed up, a little more broken down, I'm going to go back to the original stroke, just starting at the knee, going down to the ankles, but this time going a little deeper. You can use your thumbs or your fingertips. I wanted to show the fingertips here just to show that as an option. And just like we did with the thumbs, you can do a little left and right with the fingertips, a little cross friction if you come across some tight areas in the muscle. If you want to go a little deeper or your hands are getting tired, feel free to use a lacrosse ball or some different tool. You know the area you want to work, and so with your ball or your tool, you can work little circles into the tissue. That's a great way to break it up. If you want to do a little active release on the tissue, what you want to do is press your ball or your fingers into the area we're working, and then lift your toes up. As you can see here, I'm lifting my entire foot, but that's exaggerating the motion. The most important part is to lift your big toe or your toes so that you're getting an active movement while you're breaking up the tissue. I like to finish my massage and tissue work with some light to medium strokes, just refreshing and flushing out the tissue and continuing that blood flow.